What's going on, guys, and welcome back to the channel. Disclaimer for you. This is my review of a study from the NCBI. This is not medical advice. Always talk to your doctor before taking supplements, even if they're on Amazon. Critically important. I get no money from the company whose supplement I'm taking. I am taking Nattokinase. I even won't tell you what company. That way you don't have to worry about it. And I always talk to your doctor before you take any supplements. Okay, now that we got those out of the way, let's dive into what we're talking about today. So you can see here that we're talking about Nattokinase. You can see here that the study was from 2018, and you can see there who conducted the study. Now, the key takeaway, and I'll highlight here, is that it is important in reducing cardiovascular mortality, right there. Oh, that's a pencil. That's my bad. Let me erase that, and we'll use the highlighter. Cardiovascular mortality. There you go. And it's demonstrated potent fibrolytic activity. It's anti-hypertensive, which means it lowers your blood pressure. Anti-atherosclerotic, lipid lowering, so it lowers bad HD, like HDL and stuff. Anti-platelet, and neuroprotective. Neuroprotective basically just means if you have a traumatic brain injury or a stroke or a clot, it has some sort of way of protecting the nerves. Doesn't mean it's actually going in there and strengthening nerves and make them super healthy. It just has a role to play if there's an accident or an injury. Now, that's what they're claiming. I have put the link to the study in the description so you can read it for yourself. It's a lot of things. I'll tell you up front here. Bottom line up front, am I taking this? Yes. Second thing you need to know, I'm not taking it for anything other than the effect that it's supposed to be anti-fibrin, which means it breaks down fibrin, which is found in blood clots. All those other benefits, specifically the anti-sclerotic, you'll see I take umbrage with that. Anti-platelet, take umbrage with it a little bit. Neuroprotective, no issues. Lipid lowering, I guess it does. The study is from Japan, and they're pretty good at this. And anti-hypertensive, yes, but not nearly as much as you think. It's on the order of 5 millimeters of mercury for systolic and like 3 for diastolic. Gonna amazingly reduce anything? No. And it's probably because it reduces any fibrin anywhere else in your system, and it helps with your blood remaining what we call not sticky. It would be the scientific term there. So without further ado, let's dive further into the study. What we have here is their figure 1 from. So how does it work? Well, the first way that it works is directly on the protein called fibrin. So when we read proteolysis, don't forget that means protein is proteo, lysis means to break. Nattokinase breaks down peptide bonds in fibrin. Fibrin is what's responsible for creating this like mesh-like net that collects fragments of platelets and creates your clot. So fibrin is really important for clotting. And Nattokinase directly attacks that and breaks up, is what this study seems to show. That's in contrast with an indirect way, which it activates other pathways that then attack fibrin, which you'll see here in a slide and then the next slide as well. So it has direct and indirect. And what it does is it breaks fibrin down into smaller components, which are not active, and because they're not active, they won't cause any blood clotting. So that's how it works in its primary method. Now let's take a look at how it works in its secondary methods. It also has plasminogen activation. It's believed to activate the plasmin pathway, which is another enzyme with strong fibrolytic activity. So now we have two. It's directly attacking fibrin, and it's also activating the thing that breaks down fibrin. It also breaks fibrin down into soluble fragments, and this is important because it means it can be eliminated by the body easier. Imagine if you broke something down, right, but you couldn't get rid of it. And it would just float around and it could cause all sorts of complications. The good news is Nattokinase breaks down fibrin. It breaks it down into easily disposable pieces without what appears to be serious side effects, according to this study. Now remember, all this is me talking about this study. Before you even consider taking this, you should be talking to your doctor. This is a review of a study of something that I personally chose to take. So, disclaimer. By activating plasminogen, Nattokinase directly promotes the breakdown of fibrin. So directly and indirectly, it's breaking down fibrin. How does it work? The third way, enhancement of clot-dissolving activity. It may also increase the activity of plasminogen activator, or tissue plasminogen activator, which is an enzyme that converts plasminogen to plasmin. So you just see it's kind of affecting the same thing. It's directly attacking fibrin, It's activating the things that attack fibrin, and this contributes to the breakdown of clots. Now, here are some studies that came before this one. So in 1990, which is before probably anyone watching this was born, we can see that in Japan, they had a study. I believe that means there were 12 participants. They did 3 times nattokinase daily oral administration and resulted in enhanced fibrinolytic activity and plasma and production of tissue plasminogen activator. That was according to Sumi et al., and that is the title of their article right there on top. Enhancement of fibrinolytic activity and plasma by oral administration of nattokinases. The second one that I highlighted was from 2009 in Taiwan. 45 people in this study now. Blood coagulation factors is what they were looking at. 2 months of nattokinase treatment significantly decreased fibrinogen factor 7 and factor confirming a promise, that must be a typo, confirming a promising cardiovascular benefit. So again, they're looking at this and saying, okay, it has anti-fibrin activity. 2015 in Japan, 12 people. Thrombolysis, breaking down of clots, and anticoagulation. The blood fibrinogen degradation products were significantly increased 4 hours after nattokinase administration following a single dose of 2,000 functional units. Fun fact, 2,000 functional units is the average dose that you'll see on any of these on Amazon, on average. If you know how to read the label and look for that information, you can see if it's 2,000 units or more. It supports the idea that nattokinase is a useful fibrolytic and anticoagulant agent to reduce the risk of thrombosis and cardiovascular disease in humans. And here's this last one. Clinical study on the effects of nattokinase in the carotid artery and atherosclerosis. Now this comes from China. I'll highlight that. Let's see if I learned my lesson. I have. And here's why I'm putting a red mark on China. A little bit of a tangent. If you're not familiar with China and how they publish papers, it's a mess. There are a lot of bad studies that come out of China because in China, how I understand it, one of the ways that doctors get ahead is by publishing more papers than their peers, and that's how they get promoted, raises, all that stuff. So what they do is they pay money to places, to companies, just like we do in the United States. When you're in college, you don't want to write that paper, so you pay someone to write that paper. In China, you can pay for people to write a scientific paper, give it back to you, and you can publish it in China. And that adds to your total count of papers to make you a more competitive candidate for promotion. Whenever I see that a study was done in China, I have questions because I don't... let me put it this way. I have questions about any article that I read. I always want to see who's providing the money. I always want to see who's doing the study. I always want to see... the money going in, the money going out, who sponsored it, and what's the outcome, right? Because we are just getting over... the Alzheimer's research debacle, where a decade of research was undone because the foundational paper upon which almost all that research was done was found to have been erroneous on purpose. A lot of people do a lot of things for funding. Keep that in mind, and when I look at China, the second layer on top of that is not only do a lot of people do a lot of things for money, for funding, 2, it's part of your career progression that you have to publish a ridiculous amount of papers to get that position that's coveted that you want, and you find a way to make it happen. I doubt the papers that are being written are sound. That being said, they say here nattokinase was used, and it effectively suppressed the progression of atherosclerosis in patients with plaques. Big takeaways here. What are they? We know that nattokinase has an effect on fibrin. We know that it directly and indirectly targets it and breaks it down. We know that it also lowers blood pressure. That's a study that I didn't add here, but you will see it when you click on the link in the description, though it's not significant. If I remember right, it was by 5 points systolic, 5 millimeters mercury systolic, and 3 diastolic, which I think might be statistically significant, but in my opinion, it's not amazing. If it was on the orders of 10s, 15s, I'd be listening, but it's like 5 and 3. And we also know that, back according to the original figure, it has effects that help with hypertension and with cholesterol. That seems to be pretty well proven. So, something to talk about with your doctor. Don't forget about the disclaimer I put in the beginning. Always consult with a doctor before considering to take anything. Just because it's available on Amazon doesn't mean you should probably take it. This is something I added to my diet that I found immensely helpful. I mix it in with my morning matcha, and I love it. I notice when I'm on it versus when I'm off of it, and I have felt immensely better since taking it. That's, again, my opinion, not my medical advice. Talk to your doctor, see what they think before you take anything like this. Thanks for watching, and I hope to catch you guys in the next video.